So when thinking about Antabuse as a medication treatment for heavy drinking alcohol use disorder, it's important to remember the medication is 65 years old approximately. It's a very old medication, and that doesn't mean it won't work, but it tends to be a dirty drug in that it has lots of different effects in your body on multiple different systems, that it's not really a targeted medication. So Antabuse is the product name for the medication called Disulfiram. Disulfiram works by inhibiting your liver's ability to metabolize alcohol, and it blocks a certain enzyme that breaks down alcohol in your system. And what happens is you get a buildup of aldehydes. And aldehydes are a different organic chemical other than alcohols that are toxic to your body. And so what happens is if you're taking disulfiram, and it needs to be taken more or less every day for it to work, if you drink on that, the more you drink, the more the aldehyde builds up in your system. And frankly, the aldehyde is going to make you sick. So nausea, vomiting, flushing, hypertension, and people sometimes are sick to the point that they need to go to the ER to be evaluated. So you have to be careful and make sure people don't have severe underlying heart disease, liver disease before you start disulfiram. It's punitive. It's a punitive effect. It's aversive conditioning. If you know about behavioral theories, it's aversive. And so things in treatment don't need to be aversive for them to work. I mean, we would rather try to give positive reinforcement when possible. Human nature being what it is, we do tend to respond to negative consequences oftentimes when we don't respond to being healthier, to making a better life. However, having said that, is that I think it's punitive overall. And so I really don't prescribe it. Occasionally, someone will come to the program on it having sworn by it as a medication that got them sober. And in that case, I'll prescribe it. I'm familiar with it. I'm fine continuing it, but I never start it as a first line agent. Antabuse is often used in programs where there's enforced sobriety. And if you think about it, there are certain jobs where any amount of alcohol use is dangerous. Pilots, bus drivers, truck drivers, and transportation. Sometimes physicians have that program and nurses have that program where they're held to a standard of enforced abstinence. And it has its place there because it works and you get really sick when you drink on it. So, I mean, I don't recommend Antabuse. It can be a useful tool. I would say once in a while there's a Hail Mary case where everything else has failed. You have a really motivated patient who understands the risks, and then it might be worth trying. And every once in a while, Antabuse is prescribed, but in general, it's not. I would say though, for a highly motivated patient who's failed other pharmacotherapies and having a lot of consequences, they may not be in a program of enforced sobriety, but they're close to it, they may choose Antabuse. But in general, I don't recommend it. I feel like the other options we have are better alternatives.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.